acute care, I think there are a few things better than Western medicine.
I agree.
What we don't do well in Western medicine is chronic. Yeah. And we are at a place in our world where a vast majority of every sickness, illness, and disease is a function of what is chronic.
Yep.
And that's where, again, they didn't learn it in medical school. I implement wellness programs in doctors' offices, and there was a doctor we were working with down in Maryland, and he was saying they had one class on one day for 3 hours on nutrition.
Hi everyone, this is Dr. Christina Rahm, and I am with Jen Trepeck.
We're celebrating.
We're celebrating because I have a speech impediment and I was trying to say the last name. So I was like trying the whole time. You have a beautiful smile, and
thank you.
I can tell already you're kind. It's great. I love meeting really good people, especially people that are into health and wellness and food, because food is health and wellness. I'm just going to say that. And you have a Spotify, correct?
Yes, all the
you're
podcast
really famous.
Platforms. That's very kind.
Tell the audience.
All the podcast platforms. My podcast is called Salad with a Side of Fries. So if that gives you a clue as to, how I tick.
Yeah.
I
have to ask you a question. When you go eat,
Yeah.
what is your standard thing to order for lunch?
Salad with a side of fries.
Do you do that?
Yes. Well, that's where the name came from.
Yeah.
Because legitimately, I order it, often.
That's so funny because I love fries and I love salads.
Yeah. Right.
Yeah.
And but it depends. Change it up.
Yeah.
I'm one for a lot of things in my salad.
Yeah.
So,
Yeah, it's a whole meal. I mean,
Right.
You can have salmon, you can have...
Exactly.
There's so many things.
But it's also balance.
Yes. I actually, so I just keep going back to school. I would like to go back to college when I was 19, where I could have fun all the time.
Right.
Those are some of the best memories of my life. In fact, the person we just did the podcast with she was in college with me.
No way.
And we were talking, it was like every day was fun. Do you know what I mean? Because you don't really have quite as much responsibility yet. You don't have all the bills and everything else. But I kept going back to school because of being a scientist and what I was doing. So I actually went back to Cornell and studied nutritional counseling. And it was mind-blowing to me. And so you would think after years of school that I would have known what they taught me, but I didn't at all. So Cornell has one of the best nutrition programs. They're really famous for that. And I was blown away. Because all this stuff you learn, and I'm telling you, my emphasis has really been engineering, nanobiotechnology. I was in the bioscience and in pharmaceutical biotech and the natural supplements. But I was blown away because nothing they taught in that program, I wasn't taught any of it in school. I mean, not any of it. Like I would have said a keto diet was best or the Mediterranean, but they ended up teaching us, of course, that no, it's a balanced diet. You need to be doing different things. So I love what you're doing to educate people because people don't know.
Thank you.
And then
Yes.
they go buy a book, for example, on keto, and then they live by it.
Yeah.
I'm just being honest.
They try to live by it.
They do.
And while I loathe that word, I think it fits in this context because a lot of the diets or plans or programs that are out there start on the premise that their objective is for you to lose a lot of weight very quickly.
Yep.
And what the consequence of that is that it's less about the quality of the weight that you're losing. So when we cut out whole food groups, dramatically cut calories, do all the things, right? Eat less, move more, everything we've been taught.
Yep.
When the number on the scale goes down, we're losing water, muscle, and bone. And muscle dictates metabolism.
Yeah.
So when inevitably we feel like we can no longer eat that diet's protocol,
right?
We go back to these old eating habits. We start to gain the weight back. because we're frustrated that the number on the scale stopped moving.
Absolutely.
And it feels unsustainable, but we have less muscle on our body to be burning that extra fuel.
Yeah.
And so over time, with each diet that we attempt, we lose the weight as water, muscle, and bone, gain it back as fat. Lose it as water and muscle and bone, gain it back as fat. And what ends up happening is we might be at the same number on the scale on that high end as we were before, but by body composition, we can be fatter at that same number.
Right.
And it's part of why I get so frustrated with, a lot of the doctors even that we work with. And our insurance companies that say, well, the BMI says. And it's BMI is height and weight.
But you have to go back to, we used to teach the pyramid, right?
Right.
Right. I'm
Right.
sure you know this. We're outdated, and our medical science
Beyond.
books are beyond. And I say this all the time. You learn from a book. Now, I can tell you research scientists don't. They have to invent. So like when I went back to school, we were only graded on a new invention, right? A new patent. We had to create something new. You could not go based off of, when I went back in nanobiotechnology, you couldn't go based off of what you read in this book, right? You had to create, because they're outdated.
Right.
And then everyone's followed them. And so really you have this unrealistic, it's kind of interesting to me. It hit me when I was in the classes at Cornell. I eat pretty healthy. Yeah. Like I have this, people kind of make fun of me because I pick at things, right? But it's okay. I'm eating protein and vegetables.
Beautiful. Yeah.
I do love guacamole and chips and salsa.
Quality fat.
I could eat that every day.
And balance, right? It's not about, eliminating these whole food groups and then saying, to be healthy, it means not enjoying your life. Like, that's not the plan.
That's not true at all.
At all. And that's why, we describe salad with a side of fries as wellness without the weirdness. Because it's not only eat things that are green and never enjoy these, it's about having our health and living our lives.
Right. And I think it's so important. And, when I ended up getting into like natural supplements, and of course I understood the world of pharmaceutical very, very well. Because I was at Pfizer and J&J and Biogen and Alexion. But I also understood the side effects that went along with what we had. That being said, I say this all the time, I have 4 children. If there wouldn't be modern medicine,
right.
And when I had a C-section with my daughter, I would have died. You have to have antibiotics. You have to have pain medicine. You can't cut someone's whole stomach open and think they're going to feel nothing, right? So I'm thankful for the pharmaceutical industry.
Absolutely.
But I also like the reality of there's some things you shouldn't be on for the rest of your life because of the side effects that are involved in that. So jumping into the world of nutraceuticals, it kind of blew my mind there too because I started realizing there weren't a lot of checks and balances. There were pharmaceuticals that if you pick up nutraceuticals, if you look at the label, sure they have the right ingredients, but how are they made? Are they synthetic? Are they natural? And then I had to learn organic. You can just buy the organic certification.
Right.
I had to learn that, I'll give you an example. We have a coffee that is free trade and it is mycotoxin free, which is very unusual. 91% cup score. We use a process I created. First of all, we source it from where there had never been GMOs or pesticides, but we used a process where I clean things out to detox them. It's like cleaning your body, right? Or brushing your teeth. So there's only 2 coffees in the world that have all of those things because it's so hard to obtain.
Right.
To get mycotoxin, no fungus, no toxins. And what people don't realize is vitamins and minerals, seeds, plants, oils, hold on to all of that. So you have to be really careful. Just because something says organic doesn't mean that it doesn't have a virus or a parasite or a fungus.
Well, and that's why with all of the health information out there, whether it's with supplements or with food.
Or with food. Because food, for me, these are food supplements, just so you know.
Yes.
It's classified as food.
Yeah. But it's a piece of understanding. It might have that stamp on the front.
Yeah.
But depending on, I live in the real world and not everybody has the commitment to the research and figuring it all out.
They don't have time.
Right.
Yeah.
And so I think that's where experts in education balance all of these things. But there's a piece to it of saying, the label might be telling us one thing.
Right.
is it all the information we need to know? Is the marketing piece what's really important? I actually, speaking of supplements, a friend of a friend was telling me a story yesterday where kind of out of nowhere, never out of nowhere, but felt out of nowhere, she was just feeling off and craving all of these like white foods, like cottage cheese and rice and, you know, really unusual for her. And her liver enzymes were very, very elevated.
Wow.
And the, you know, investigation essentially revealed that she was almost poisoning herself with the supplements that she was taking.
Yeah.
It
happens a lot. Yeah.
It does. And there are so many binders and fillers and other things. And, you know,
to your point. Not all companies, we don't use them.
Right.
But the problem is, even if you see a label, you don't realize, I'll use an example, vitamin C, right? Absorbic acid. There's so many ways to obtain it. But even any vitamin C we use, I clean it. And if you say to me, why you're ordering everything organic, you're making sure it doesn't matter, because I understand that those are binding onto things that do hurt your liver, do hurt your kidneys. You can actually hurt yourself more if you're taking the wrong thing. It's a hard conversation to have because people they don't really understand it.
Right. And those kinds of extra steps often translate into the price that we pay for something.
That's the problem. And I just bought our main manufacturer because even though they follow my patents and my processes, I was worried about what about when I leave, what's happening, and I wanted to control the whole process from farm to table all the way out the door, which is a very expensive, I'm just being honest.
It is.
Very huge undertaking, and it never ends. It's kind of like raising a child. It's I don't know if you have children yet, but just so you know, if you do ever, which I always tell people this, having children doesn't make you happy. It's just one of those things you choose or not choose to have. And I love my kids, but it's a lot of work too. Love. I care so much about the products we make, but I'm being honest with you, it is a lot of work.
Right.
And I'm always hard on myself because I'll catch something that I'm like, that should have been better. That should have been cleaner. That I should have sourced that differently. I should have processed that patent differently. And it's a lot. You have to kind of be a perfectionist, and then you have to be probably like you are about what you're doing, because it's so important to the world. You have to be passionate.
Yes.
Enough to be, and you have to be patient. Because explaining it to people, I think it's overwhelming to a lot of people, to be honest.
And of course it is. I mean, decades I have spent, learning and continuing to learn. And as new research comes out and all of those pieces. And so for the average person,
it's just too hard.
It is too hard, but it makes the case.
But what about the average person? So what about the doctors and the scientists that don't know either? Because think about me. Here I am. I went back to Cornell for manufacturing and for nutrition, right? Because I knew we were going to take over manufacturing, and even though I had been involved in it before, I wanted to understand more of the pieces for the patents and the processes. And I just have to tell you, for me to have gone to so many countries, I've worked in 92 countries, I've gone to lots of different schools, for me not to know that information, I'm not the average human being when it comes to science education, right? Because of my career, but why didn't I know all those things?
Right.
So even if they seem like they're an expert in medicine and science, they may not know.
Well, and that's the thing I also reiterate to people all the time is that, it's not even our doctors' fault that they don't know these things.
No.
It's not part of the curriculum.
It's not.
And the expectation, especially given the way, our Western medical system works, and reimbursements have evolved, they have to see, there's a reason why you're waiting so long. It's because they have to see 800 patients a day to keep the lights on.
Well, and I don't blame them at all.
Exactly.
But I try to explain.
Exactly.
They didn't go to school for that. They didn't learn that in school. And even, I'm just going to tell you, they take one class typically in medical school for pharmaceutical products.
Right.
So when I was in the pharmaceutical industry, explaining something where we're working at creating drugs, right, or human monoclonal antibodies or cloning or whatever we're doing, explaining that is almost, you have to change the way you're talking, even to a doctor, because they didn't have that same education. they're smarter than I am at a lot of different things when
Right.
it comes to a diagnosis. Although you may not know this about me, my big thing is live the life you want, not the one you've been prescribed, because a diagnosis just comes
please.
out of a book where you check a box and the answer is what people don't know is they don't really know. This is an estimated, educated guess.
Right.
Even on a cancer cell. Yeah, the cell's looking different. Yeah, there's a tumor growth, but you don't actually have all the details to that. And that's
Right.
I'm very careful how I say that because I don't want people to think that doctors aren't extremely smart. They are.
Exactly. I think, the piece to recognize for everybody, I think, is that Western medicine, as you were talking about with your kids, right? There is a place for it. Like you break your arm,
absolutely.
Something really, an emergency, acute care. I think there are a few things better than Western medicine.
I agree.
What we don't do well in Western medicine is chronic. Yeah. And we are at a place in our world where a vast majority of every sickness, illness, and disease is a function of what is chronic.
Yep.
And that's where, again, they didn't learn it in medical school. I implement wellness programs in doctors' offices, and there was a doctor we were working with down in Maryland, and he was saying they had one class on one day for 3 hours on nutrition.
Yeah.
And again, going back to the food pyramid, that was based on economics and getting us to eat what we grow in this country.
Procter & Gamble.
Right.
I love Procter & Gamble, so I'm not talking bad about them, but that's where that came out
But
of.
it's the reality. And so, I do think more and more it's part of the conversation for people to reclaim ownership of their health.
Yeah,
and understand what it is that we're having. And one of the things, if you're taking supplements, and you go to your doctor and you're putting the things on your intake and updating, and they're resistant. Mm-hmm. Number one, recognize that just wasn't part of their education.
Right, they don't know and they're worried.
And
right,
and
they probably do know there's side effects from some of this. Like one of the things I do when I do educational presentations, which I do a lot, is any product we have, I do the side effect profile. But I'm from the pharmaceutical industry, so for me, I'm not going to present a nutraceutical product and not say these are the potential side effects, but I want you to know this. I'm criticized for that. Because if I say the side effects, then the conclusion is, well, that's not good. But I'm doing the side effects based on basic ingredients and understanding the science, the steady state, the peak plasma level, the pharmacodynamics of everything going on. Because of my background, that's not typical in the supplement space. Did you know that?
Yeah,
like if you say,
I do a lot in the supplement space. Yeah, exactly.
Like cumin seed oil. Could someone be allergic? Yeah.
Absolutely. Right? But the piece to this is a couple things. When you bring supplements to your physician, number one, understand they didn't learn it. Number two, I always recommend bringing it to your pharmacist rather than the physician, because the pharmacist knows a lot more about interactions.
Absolutely.
And the question to ask is, will anything in here hurt me?
Yeah. Or interact with my medication.
Correct.
Yeah.
So it's asking the best questions to the best resource we have in a situation. And the other thing, when a physician says, oh, those don't work. Yeah. Right? One of my favorite things, and I wouldn't say this to your doctor, but one of my favorite things is to say,
don't say it,
right?
Don't say it came from you,
right? Right. But if we were going to have a procedure, right? If I was going to have a procedure, would you recommend that I stop taking supplements before the procedure?
Yeah.
And the answer is yes.
Yeah.
Well, then they certainly work. We know they work.
Well,
because you tell me
that's what I say to
taking
people. Why they say they're not doing anything, but you have to stop 48 hours before you do radiation, chemotherapy, or surgery. Right. I'll give you an example: warfarin. So grapefruit, you can't take it when you're on warfarin. Turmeric curcumin makes it work more. So if you're on warfarin, you may have to back out. When I explain that, people are like, "Well, then why didn't my doctor?" And I have to go back to. That's because they didn't learn. They didn't learn in school drug-to-drug interaction with pharmaceuticals either. What people don't know is you're writing the script, because that wasn't their job, right? Right. The pharmacist, the PharmD's job is to evaluate that and see if there's any interaction. So we work with the doctor, Dr. Fadwa, who's a PharmD, and Henry Ford, and she's a PharmD, doctor of pharmacy. And she's great with our company because she understands it. She's practical. She understands answering it. But I will tell you this too. As much as we educate, as much as and as much as we hit all these labels, right? And as hard as I try, there's some people that just don't want to hear the side effects, or they don't want to hear the reality. And I'm just going to tell you, my job is not to lie. My job, because here's how I feel. This may not work, this is Give Me Back My Youth. It's a collagen colostrum. I love this product, but it may not work for everyone, right?
Well,
and I don't even find that up. I don't get upset about it.
No, and for what it's worth, pharmaceuticals don't work for everyone either.
No, and here's how I explain it to people. If I'm making a salad at my house, does that mean I'm never going to eat a salad when I go to a restaurant or at someone else's house? I actually use all the products that I've worked on because I feel like I made them for our family, but I use other products too. And if you ask me if I use everything every day, no. There's some products that we have, like Clean Slate and Zero In, I use every day. Immune Defense Shield. So there's some things, but not everything. And people are shocked when I answer it that way. But my comment is, I'm not going to lie. I'm going to tell the truth. We're human beings. Our DNA, we're all different. And these products do not work for every single person, for every single situation. And they can't fix everything.
Well, and I mean, think about how often we're not told about the side effects of something. We take something, we don't feel quite right, but we don't know what it is. And then we spend an inordinate amount of time trying to figure it out rather than saying, here are some things that you may experience in taking this. It doesn't even necessarily mean that you must stop taking it.
No,
it's about the awareness. Right. It's about the awareness of what happens.
Like L-theanine, L-arginine, there's a product we have called Zero In. I love it because I'm working all the time. I'm traveling, I'm on and off planes, and I was not a big fan of Adderall for my children or for me. As much as I have ADHD part of the time, I literally made an adaptogenic because it was originally for women and sex because I had been at Pfizer with Viagra. I wanted something for women. We don't have a lot of stuff out there, and it actually does work, but it also works for cognitive functioning and performance. So we have tons of kids with ADHD and autism that their parents give it to them. It helps them. Two of my children, it helps considerably that have it. But my thing is, I can't take that on an empty stomach. Now, my husband can take 5 on an empty stomach. If you ask me, I almost gave up on taking my own product because if you think about it, even when you make something, it may not be for me. Even though I would like it to work for me, it may not, right?
Right.
But I kept getting sick, and then I realized, oh my gosh, I need to take food with this. And so I tell people that, and then I'll hear someone else say, well, like my husband, I'll take 5, and it doesn't affect me. That's right, because we're different. Right. We're different people. So I think understanding that as a person, a supplement does work typically. It may have a negative effect. You've got to know where it's made, if there's synthetics, if there's fillers in it. If there's dyes in it, you need to be well aware of that because those impact you. And I explain organic like this. I was in Malaysia working with their government. I went to eat at a restaurant. It was at the end of a pier, beautiful restaurant. I noticed, though, that there was some pollution in the water, like trash. But it was Malaysia, and sometimes they'll put... So I go there. They have this huge 2 chefs. They make this elaborate presentation. We're going to have organic fish, organic food. Then I go to the bathroom, and there's a hole that goes into the water from the bathrooms there. And there's like 6 different bathroom places, and they're right by our table. And so I realize all the bathroom is going into, okay, that's fine, but I tried to tell them I really wasn't hungry. They explained to me I had to eat, that it was just a big deal. I was sick for a week. So here's what I'm going to say. Just because something's organic.
100%.
Can you talk to the audience about that? Because I say it enough. So can you?
So I'm with you. And I think a piece of this is when we look, like I think astaxanthin's a really good example of this, where the world's natural resources of astaxanthin are pretty contaminated.
Yeah.
And so we don't necessarily want the, organic from the source astaxanthin, rather something that is lab grown in an environment where we can ensure, because think about any supplement, it is a concentrated form of whatever
it is.
the food or nutrient is. So it's just like, I compare it to dried spices, right? Like dried spices, you're taking all of these, the plant, drying it, and then grinding it up to get you your dried spice. So a little bit of that dried spice is actually a whole lot of the actual plant.
Absolutely.
And
it's
so,
concentrated, like we call
right.
it in science. Sometimes we'll call them isolates or isolates.
Right.
Like there's different words we use, but
Right.
you're exactly right. It's a concentrated amount, and that can be really good or really bad.
Right. And it's just about choosing, asking questions, working with someone who does spend their time doing the extra research or figuring out what your personal best regimen is. And because again, we don't necessarily know how something's going to affect one person versus someone else. And so working with somebody who's more familiar with the products and can explain those things and understands the sourcing, because let's be real, most of us don't want to sit and do all the research.
Well, first of all, sourcing's a lot of work, just so everyone knows.
Yes.
I'm working on a source right now for one of the governments. I can't even tell you how many hours I've spent so far. And it's over a college and in a classroom, and I'm having to look at, it's a large contract. Mm-hmm. I have probably spent 40 hours right now trying to find what I think is the best source. And now this one I can't use because I created with another company a cruelty-free program. It's a 50-page document. We are the only cruelty-free to make sure, I grew up on a farm, I wanted to make sure the animals weren't impacted. That was a huge lift, right?
Yeah.
But there's not enough of the source for the contract that I need. So I'm looking all over the world, and I'm just going to tell people, you have to be passionate, because it's taking me, now could I go back to that person, or it's a government? Could I go back to the government and say, this is the best one, and not know? Right. Yes, but I'm not going to do it. I'm not going to do it. So that takes that extra step.
And it's interesting. So I think it's important for also people to realize the phrase that's thrown around a lot is that supplements aren't regulated. Supplements are in fact regulated.
Well, they are regulated. I was going to say, I'm going through all this.
They are very regulated, and the regulations are different across the world. And for what it's worth, the U.S. regulations are some of the most lenient. So
they're the hardest in some areas. I will tell you, it just depends. It's we ship to 80 countries. So I want you to think about this for 1 second. Every country has different regulatory compliance. So just so the audience knows, the UAE, India, Australia, Canada, Switzerland, they're all different. So some of my products are considered pharmaceuticals in some countries, but we have passed regulatory and compliance in 80 countries. And if I tell you how hard that's been,
well,
it has been so hard.
And and it's not easy, but for some people, right, like if you're choosing something that we know has met the criteria in a variety of countries around the world, that's very different than likely the one that's $12
at the store,
at your drugstore.
You don't even have to be cheap.
Right.
Here's what's crazy that I didn't even. You don't have to be, so I am registered as a scientist with the FDA and with GMP, and so is the new manufacturing plant, Strata Biotech, that we opened. And then I registered with the Department of Defense, with biologics, with over-the-counter, with all this stuff you have to do, all this paperwork. And now we're working on NSF and ISO 9000. There's all these criterias, right?
Yeah.
But what's so weird, what makes me mad, if I'm really honest, you have products out there that have none of that, and they're allowed to be sold in this country.
Right.
So I'm frustrated.
For sure.
Because it's like, wait a minute, these people are buying something. Do people understand that some of the products are made like in a garage or in a non-compliant place? I mean, honestly.
And the other piece that I think people aren't aware of that's really interesting, and I think especially gets the consumer at their heart, right? And not just those things are being regulated, but the claims that you can make about a product are regulated. And so if somebody is telling you that it is going to cure the disease, right? You cannot say those things. No. And so beware of the claims that you hear and the things that people say, because it matters. And if they're willing to make those claims that they know they aren't supposed to, what else are they willing to do?
They can.
And I'm making a leap, I get that.
Yeah.
but I think it's an awareness
No, I think
piece.
it's true. I think I have to say, I'm not in sales and marketing. You know, I'm in science. So for me, everyone in the company knows I'm extremely careful. I think they get frustrated because every time I do a talk, I always say I can never claim to cure anything. These products can't claim to cure anything. My big talk is, get to the root of the issue, to cure the causes in your body so your body's healthier. But here's the truth. You can't claim it. We have a patient registry in 80 countries, though. So that is, give me one other nutraceutical company that has that. That's because I did it in pharma. So I feel like we should do the same thing in the nutraceutical industry, but no one's doing it because it isn't regulated.
Right.
And then we develop case studies with doctors all over the world. But I'll say this, it's expensive.
Right.
It takes a lot of human capital. I say this all the time. Human capital is your most important thing in life because people are so important in what they do and the work they put into it. But I do think that's one of the most frustrating things about my job. I'm so glad we're having this conversation. I get very upset because here's the thing. When you're shipping to another country, like UAE now has standards where they won't let you ship anything that has anything that's not organic or anything that has any kind of pesticide. Like even their outerwear for like we have a protective clothing line. To say repellent is fine, but they don't let any kind of chemical be. Thank goodness ours is all natural, right? So we're working on a contract with clothing because that's really important.
Yeah.
And we've had 2 meetings when we've been in Dubai. But I'm frustrated, you're right, because to explain this whole conversation, people don't know them. They don't know this at all. And you could go downstairs to a store or to a small shop. You could be buying skincare, which should be heavily regulated. And for us it is because we're shipping to all these countries.
Right.
But if I were just in the United States, I could be producing anything I wanted, which is kind of crazy, and the regulations really aren't there that should be, in my opinion.
I'm a big fan of, salad with a side of fries. Like, pick your battles, right?
Yes.
Your level of commitment today is not necessarily the same as your level of commitment in a month or in 6 months or in a year or beyond. So it's what can we do right now? What can we do consistently right now?
Yeah.
And just take steps toward better health.
Absolutely. I think that's why what you do is so important, and I think your education,
Thank you.
keep doing it because people have to hear it. Do you know what I mean? And it's still a slow, direct process because if everyone watched you, they would hear it over and over. For me, it's a little harder because I don't just create the root brands, we have manufacturing. So my expertise is really cleaning products out and then making them bioavailable and safe and efficacious. That's really where I'm brought into projects throughout my career. But I also do full formulations. But the goal for me is to make it work in the body safe and efficacious. Understanding that when I worked in the pharmaceutical industry, we went after one claim. We were only given one claim at a time. If we wanted to do another one, there's another $50 million to get that.
Right.
So to claim that all the products, so I always say this, and Clayton, my husband, came up with this, and I love it. The goal of the products is to make your life greater, better, happier, and hopefully they will help with that. But what you're doing, I think, is so significant because people don't know what you're saying.
Yeah. I know.
And then,
and we're changing that, right?
Yeah.
Each week we're getting it out there and helping people change the conversation around wellness and health and nutrition and all that. So
they keep doing this, so I have to go.
I know.
But thank you so much.
Thank you.
I love what you're doing.
Likewise.
I really do.
Thank you.
Thank you. It's important. Thank you very much.
Appreciate it. Thanks for having me.